Excellent. So it's right on time, and we are going to be backing right up to another course that we have this afternoon. So I'm going to get started right on time so that we can finish right on time. So welcome everyone to our free monthly webinar. This month's topic is how the activator poles can help people who are at a high risk for falls. My name is Dr. Joy Cochran, if you haven't met me before, and I am actually one of the clinical evidence team members for Urban Polling. We are extremely excited to have Dr. Stephen Kanter presenting for us today. He is one of our master trainers and actually has presented for us in the past, but it's been a while, so we're very excited to have him back to give you all of this great information. Before he gets started, I would just like to touch on a few things. One is that there are both healthcare professionals here as well as end users. So he's going to be trying to address both throughout this presentation. So if you have any questions, or if he's not answering or talking to you, or if you have questions on what he's saying, please wait until the end. Put your questions as you have them in the chat box. And then at the end, we will try to address all of them. So without further ado, I am going to hand it over to Dr. Stephen Kanter. Thank you so much for being here today.
Thank you, Joy, and welcome everybody. I appreciate the opportunity to present about this topic, not just in regard to activator poles, but falls and fall prevention. And as Joy indicated, I will be presenting in a way that hopefully clinicians, physical therapists, occupational therapists, physical wellness professionals, as well as patients and people in their inner circles, their family and caregivers, can all benefit from understanding where activator poles play a role in people who are at risk of falling. And I'll speak a little bit more about a higher risk of falling. The concept of just walking and being able to walk will, of course, be included, and I'll be happy to answer any questions about that. But I'm going to focus more on falls and on balance training and the benefits of the activator poles versus other options. So let's see. So this is a little bit about me. I've been a physical therapist for now over 25 years, mostly in home care. I've worked in all settings, and I also work as an accessible design specialist. And the way that relates to fall prevention, as some of you may appreciate, is if the environment is unsafe, it doesn't matter what device you're using or how good your balance is, you can fall. So often I'll work with people in redesigning their homes to minimize fall risk. Other than presenting about fall prevention here, I've presented on many other topics. Previous to this year, I was working at the International Multiple Sclerosis Management Practice for 15 years and had the fortunate opportunity to use these activator poles and transition our gait training and fall prevention and balance exercise program to include activator poles as soon as I learned about them. So I've been using these for many years with many patients from all over the country and all over the world, for that matter. And it's important to understand that, a physical therapist, hopefully will appreciate the role that an activator pole can play in, rather than just defaulting to a cane or a walker. And again, we could discuss more about that, but hopefully by the time we're done today, you'll understand where activator poles fit in and probably work better than some things that have been used in the past for exercises, for therapy, as well as just for day-to-day mobility and activity. And I also teach at Seton Hall, so I enjoy this process of educating others from, in this case, all around North America. So welcome again. So what this presentation will be is addressing falls, speaking about clinical strategies for fall prevention. And when I think about clinical, it's not just about licensed professionals. Again, wellness professionals personal trainers, movement specialists, all can be involved. So don't isolate, don't limit it to if you go to physical therapy. And also appreciate the fact that the clinical training program has to apply at home. A hallmark of a good physical wellness program is what you do at home. So, Mindy, I'll get to you at the end if that's okay. I'll have time for question and answers. So I just want to make sure I get all the content in. Unless you can't hear me or something, I'm gonna continue on. Home exercise programs. You must do exercises at home. You must, and exercises can be stretching. It doesn't have to be sweating and on the treadmill, but that's a very important thing to be able to do. So that I want you to understand that from now. And when you finish listening to what I speak about and you think about and reflect on where activated poles can fit in, understand it may not be in physical therapy, it may not be walking in the streets, it may not be at the gym, but maybe they can help you do something at home to enhance your physical wellness. The role of the activator pole in comparison to other devices, again, the physical mobility program. So it's not just about just strengthening and just flexibility, but it's also about mobility, which includes the concept of balance and control. And then I'll get into some exercises as well. And then I'll have time at the end for questions and answers, and we can discuss about that. If you're a clinician, we can discuss. I'll also leave my email at the end for people who want to discuss offline. So, what is a fall? And there are many definitions of a fall that have been published. There are many things that you could think about are falls. Obviously, falling is going down in some way, shape, or form, but it doesn't mean you actually have to fall on the floor. You could just fall to a lower surface. So if you sit down and you plop down, okay, you just plop down on the couch. Technically, that's a type of fall, even though you didn't end up on the floor. So for many of my patients, when they sit down, they sit sloppily. They sit in a way that if that chair was not there, or if there was a thumbtack on the seat, they would just fall back. They have no control. And that is, again, a symptom of a bigger problem that needs to be addressed. So if you end up on a lower surface, that's a common definition, but it could happen in different ways. And if you then choose to be there, so if you're standing up and you're on the floor, you didn't want to be on the floor, that is a fall, plain and simple. It doesn't matter if you got there because you went down slowly or gracefully, or you ended up there because it didn't matter. If you're on the floor and you didn't choose to be there, that is a fall. So who is at high risk? Who's at risk at all? Well, in general, people with physical impairments for almost any reason. It would be easy for me to say as we get older. Sure, that's a factor, but there are many people in their 90s who do not have high risk of falling. They have an average risk of falling. And there's ways to measure it that clinicians can do, but sometimes those measurements are not very valid. And when I say they're not valid, it means that it's testing you in the clinical environment, and in that clinical environment, you may do well, or there's a lot of focus that you can put on. Versus the real world, there's a lot of distractions. Now, whether the problem is acute, meaning an injury that just happened, if you injure your ankle, no matter what age you are or who you are, your ankle is not going to work as well. So you're at higher risk of falling. Okay. Same thing with the knee or hip or back, or chronic disease. If you have a neurologic chronic disease like multiple sclerosis or Parkinson's disease, or had a stroke, those are obviously chronic conditions that lead to physical impairments of varied levels. If there are cognitive issues, that is a sort of a separate element that would need to be considered, because other factors in use of devices needs to be addressed. However, it doesn't mean for training about the balance system, something like the activated pole could not be included. And who can help? Well, again, physical therapists, occupational therapists for sure, but don't forget about the medical professionals from a pharmacologic standpoint. Those medicines can cause falls. Then we consider caregivers or people in the family. providing cues, reminding people don't sit down so sloppily or don't plop down, sit slowly. I usually tell my patients nose over toes, control your sitting, and I ask a caregiver or a family member to provide a cue or a reminder once a day. I don't want to cause divorces from too many reminders or too much conflict. And then, as I said, if your home is designed in a way to that's less clutter, fewer area mats, better surfaces, fall risk goes down. But today we're going to focus on really the physical aspect of what a physical therapist or an occupational therapist or physical wellness professional may be able to be involved. Now, this was a patient that I worked with who came in with a cane, and she just had that because she knew of nothing else. And she only needed something to help her a little bit. So when I asked her to use 2 activator poles, she's like, why do I need to? And I said, well, it's not just about needing, it's about possibly other benefits of using 2. In her case, for walking, maybe she would only use 1 activator pole instead of 1 cane. But the point I want to make here, if you could see on the left with the unilateral, the one-sided cane, her posture's off right away. Her right arm is in a different position than her left arm. So just from that standpoint, just from a postural standpoint, the activator poles work better. The other consideration, and I don't know, let me see. I think I can do pointers here. Yeah, I think I can. The other aspect here is the way that the hand is pushing down. There's many reasons why that's not ideal for people with who want to improve their balance and also who want to decrease their risk of orthopedic injury. So this is something you would need to work with your physical therapist or occupational therapist on. But I wanted to highlight the fact that just changing from the cane, she never used the cane again. She went right to activator poles overall. And again, I don't sell the product. I just recommend it. I have the patient use it. They use it. They understand clinically the difference. And what I'll present today is not just use the pole, but I'll explain some of the rationale towards why I prescribe it in a certain way. Increasing weight bearing. The idea that you can stand more when you have a device, the activator poles provide a safe place for most people to just stand up. If you are going to improve balance, you must stand. You cannot improve balance and decrease falls unless you stand as part of your exercise program. Your system, your balance system, cannot carry over exercises in sitting to standing in a way that's useful. Neuroplasticity is based on specificity, being specific in the way muscles work, the way the senses take in information and our body then responding to that information. Standing allows for sequential muscle movement, not isolated muscle movement. So those are, again, just a handful of reasons why standing is important and why almost any patient who I have in a standing program in my clinic or when I go to their home uses activator poles. Even if they don't get them, I will bring them clinically instead of having them hold on to the kitchen sink as a default or holding on to me as a therapist as a default. I will try to default to the activator poles if possible. Part of it, again, is, and I'll show you here, like I said, when you have this grip down here, you're not grabbing from above, you're here. Your hands don't even need to grab. You could actually keep your hand lightly. So there's so many elements that take away hindering the balance system. And the hand hinders the balance system. If you hold on to things, if you grab a wall, if you grab things, furniture walking, wall walking, that in the long run will hinder balance and increase risk of falls. So an active fall prevention program through exercise includes standing activities. Balance and walking are included in that, and that's pretty straightforward. But we're going to get into some of the balance, these specific balance exercises that I recommend. Movement behaviors. I'll speak about a couple. One of them I already mentioned, which is sit slowly. Okay, don't just plop. But I'll speak about having your feet wide apart as a general rule for home exercise programs and for mobility. Although some clinicians believe that having your feet together or close or having your eyes closed is a good thing, I don't personally believe that has a benefit to most people with risk of falling, but it plays a role. The exercises that I'm going to recommend today and the protocol I will recommend today has the feet apart. And the movement behavior is when you're walking or turning, make sure your feet are apart. Now, strength and flexibility are important. If you don't have enough strength or enough flexibility, your balance system can't really be effective and your movements may not be efficient. However, if you only focus on strengthening and only focus on flexibility, that generally won't help with fall prevention unless you work on the neurologic elements, which is what we'll discuss today. So, what is balance? And you may have, if you're a clinician, you've I'm sure learned about it. Even clinicians sometimes learn part of it only, or remember part of it only as being the sensory components, the eyes, the inner ear, that vestibular system, and the proprioceptors within the joint. But the other part, possibly the more relevant part in clinical intervention and in exercise, and for everyone to appreciate today, is the motor part. How do we respond to what our body takes sensory wise? How do we respond? And if we overuse sensory parts, we overuse vision, okay, or we overuse, again, our hand for different types of feedback, then how is our body responding when things change? So people who look down at their feet or down at the floor to provide more feedback, that's a strategy that can help, except if you go outside or there's a busy environment or you talk to someone and turn your head, that changes. So your program needs to address what would be a more, we'll call it normal. Normal is not a great word to use because no one's normal is normal, but something that's more typical of what we would want. We don't want to restrict our motion to looking down. So when we're standing, if we're losing our balance, our ankles will work, our hips and our trunk will work. If those don't work well enough, then we take a step. And if that doesn't work, then our arms go out. However, what you'll find in people who are at high risk at falling or moving towards high risk at falling is their hands go out with any movement, any standing. They always feel unsafe. And if you're that person, then you're probably not addressing your standing exercises enough. You're probably too fearful to stand, and that can be addressed with a lot of things, including the activator poles. But if you don't trust the activator poles, I'll tell you now, don't use the activator poles. Stand up with your walker, stand up at the kitchen sink. But eventually, if you want to improve that balance so that you can be more comfortable with functional activities, standing to get on your coat, for example, or standing to talk to someone rather than being forced to sit, then hopefully you'll integrate the activator poles or work with your clinician, even without any devices, so that you can work on your balance. So the concept of losing your balance and recovering it requires, again, your ankles, your hips, to try to keep your feet in place. If that doesn't work, then you take steps. If your steps happen too quickly or too early, usually you'll be off balance quicker and your hands will go out quicker. Now, the term suspensory strategy refers to this here. You'll see the person lowering, bending their knees to get lower. I have several patients who will walk with a suspensory. They'll bend their knees and walk, and it does allow them to walk, and it's better than not walking, okay? But it's not very efficient. You could get very tired doing that. And the whole purpose of your balance system and your motor responses is that when you're standing, to keep your center of gravity, which let's say it's at your belly button, and there's an imaginary circle around your feet. It's to keep that spot at your belly button within that circle so you can move and shift weight. These are things our body is programmed to do until something happens where it can't do it. And in some cases, whether it's an orthopedic issue or neurologic, there can be an improvement in tolerance for center of gravity movements, for body movements. often you'll see it in the literature or read about as postural sway, postural movements. Okay. So, if you read more about center of gravity displacement for your clinicians, but for people who are patients out there, you may see it as postural sway. It's basically all the same thing. So let's get into some of the exercises that I recommend for improving motor strategies. The standing nine is something that I created when I worked at the MS Center and in my home care practice as a basic set of exercises, just standing and using the activator poles to promote standing and promote some changes in center of gravity sway or postural sway. So that's the most basic one that I do standing. I will tell you that I do a series of exercises with the activator poles and sitting, which you can learn about through urban polling, and there are other ways to learn about it. But today I'm going to focus more on standing. So the standing nine. Then there are many other exercises that I do for enhancing or advancing balance training, including very advanced ones that are listed here at the end. But really, I'm going to only speak about a couple of them with the time I have, which is the up on toes, up on heels, the forward and backward weight shift, and the 3 o'clock, 9 o'clock exercise, which I, again, most commonly prescribe because they deal with the foundational parts of balance. So the first thing I will speak briefly, I'm not going to show it because it would just, we don't have the time today, but I'd be happy to speak with any clinician who wants to learn about these offline, and then hopefully patients who want to work with clinicians, I could help you with this as well. But this is a summary of what it is. But the first and most important thing I want you to appreciate is the foot positions and the fact that all foot positions will be with feet apart. Okay. In my prescription, I don't bring the feet narrow. If you bring the feet narrow here, or you put one foot in front of the other, then what's going to happen is you're going to put more weight on the arms, which will put less effort on the legs. And again, there's a sequence of reasons why I tend not to do that. So for what I'm recommending here is keeping those feet apart. That's what the blue double arrow suggests. How wide apart? Imagine you could put another shoe in between your feet. It doesn't have to be shoulder length. It doesn't have to be anything more than don't be narrow. Okay. Same thing with walking. Staggered feet, left foot in front, or it could be right foot in front. Again, the feet need to be apart. So if you have those three positions, in each of those three positions, you then have an elliptical, which is just like an elliptical machine. You're just standing. You have rowing, which is forward, backward. You can see my hands rowing and backward. Okay, so it's like a push and a pull. And windshield wipers, I actually have the poles on the ground, side to side movement. And what that does is it allows for your body to weight shift a little bit. So that's the basic standing exercise. Like everything I'm going to recommend, there is a risk of falling. If you don't have someone there to help you in the beginning, I don't recommend you just doing this on your own. Working with someone, having someone there, doing it in a safe area is absolutely important until you understand what your body can do. So, as I said before, I will give you explanation on why up on toes, up on heels is important. This is it listed out, and you can read it. But as we go to each one that I'm going to show you, again, I will explain there's a functional element and a clinical element. The motor strategy is a clinical element, and functionally, what do you need to use it for in life? Why would we want to be in these positions? And these are all listed here. So the first one, okay, the first one here is going to be on the left here is your face view, and on the right is a side view. It's the same exercise. Oh, so we have some, let me see. All right, so you'll hear me. I'm sorry. I thought I got rid of that noise. And you'll hear me counting. And then on the other side. So I apologize again for, let's see. Oh, I can't get rid of it. Okay, let's get rid of my sound. I just got to get
We
rid of
can't
that
hear
laser.
it, Dr.
Oh,
Kanter.
good.
It's
Okay,
yep,
good.
you're
All
good.
right. That's worse. I'm hearing myself not wanting to hear it. Okay. So up on your toes, 1, 2, 3, and on the heels, 1, 2, 3, and then on the opposite side. So how do I prescribe it? What is the dose of it? 30 seconds. I don't care if you do 5, 10. The difference, there's no science on almost any exercise on exact dose. There's a lot of recommendations, but 30 seconds is consistent. 30 seconds is an easy way to tolerate, to schedule it into your life. Okay. In this case here, you may see, sorry. Uh, let's get the pointer back. Nope, not the pen. Sorry. Over here, there's nothing behind her in this case. So if this person were um, at a high risk, I would have a seat or a wall behind the person because the risk of falling backwards is the biggest risk on this exercise that should be appreciated. So again, why do we need to end up on our toes, on our heels? That's the first balance reaction that we have. That's the first thing that happens when we're off balance is we go on our toes on our heels. Also, if you're going to reach for something in a kitchen, a cupboard, or in your bathroom, you're going to go on your toes. That's natural. Okay. If you're going to reach behind you for some reason, you're going to end up on your heels. While you're standing tall, you may end up on your heels. So you need that sway, as it's called. Okay. So we'll play this one, which is staggered feet, forward and backward weight shifting. And as you see, I'll get it. Nope. Wow, that's boo-boo. Sorry. Like juggling here. So let me get this again. Forward and backward weight shifting. So this here, you probably could appreciate. It's sort of part of walking. When you take a step forward, it looks like you're going to take a walk forward. The purpose of the weight shift backwards is if you lose your balance backwards, you want to have that leg move behind you. Often people with balance dysfunction or balance impairments, they don't have the ability to take that step back because they actually have hip tightness, which is why flexibility is important. Okay. So weight shifting backwards, and if you notice this person, she's up tall, she's not bent forward. This is something that most of my patients have difficult with to start, but becomes important towards as we progress in our therapy. And this is again a low level exercise because you're static, you're not really moving around a lot. Okay. So here, wide feet, slow marches. This one is a little bit more advanced. It's side to side. And this is also very important for two reasons. One, if you lose your balance going sideways, you need the ability to catch yourself and return back to the starting position so you don't fall over or have your legs cross over. We don't want that. Another thing is when you step and take and when you're stepping while you're walking, you have to get off one foot to go onto another foot, and this engages a muscle on the outside of your hip over here that is under treated in my opinion, and this exercise really treats it directly from a neurologic standpoint and an orthopedic standpoint. So that's why I prescribe this one. Now, if someone cannot get their leg up as high, that's okay. You do the best you can. The weight shift side to side is what's most important to do. Okay. So my patient in the clinic on the left, the first one was at home. The second one's in the clinic, the same idea. Okay. Now, the one on your left here, she's keeping her trunk pretty straight. The one on the right, she has a little bit more of a sway, but the feet are staying apart. They're both doing a great job, but it didn't happen at the beginning. It took a while for them to get there. So 3 o'clock, 9 o'clock exercise deals with the rotational part of movement. If we need to turn around, but also the fact that our body twists when we walk, when we move. There's a natural rotation, which decreases or it starts to become a problem when we become less mobile. And again, it's very well published in the literature. This happens with older population, but that literature is dealing with older population when exercise wasn't really as exercise right now is pushed so much that people who are in their 70s, 80s, 90s now are way different than when those studies were published, 10, even 10 or 15 years ago. And 20 years from now, the fact is, if you do exercise your whole life, you're not going to end up with those same limitations that an older population may end up with. Nonetheless, this exercise will teach someone to, again, tolerate rotations and tolerate the ability to take a step. So if they are turning and they lose their balance, losing their balance, you don't want to cross the legs when you catch yourself. You want to keep your legs open. So in this case, there's limited rotation that I have for this particular one, but I eventually add rotation to that. So it's important to understand that all of these exercises can be done on a regular basis, not just with the physical therapist, not just when you get injured. So for people who want to work preventatively, prophylactically, to prevent their balance from getting worse, these are some basic exercises to do. And there are, again, many advanced exercises that can be recommended to prevent people to end up at a high fall risk. But these exercises can even be used for people at high fall risk now to decrease their fall risk. And by decreasing the fall risk, it doesn't mean the person who's at risk of fall, they may still feel unsteady, but what will happen is they can tolerate standing longer, or they feel less fearful when they're taking a step or a couple of steps in the home environment. Or maybe if they go to a restaurant and get out of a wheelchair, something like that, they can still get up and not need to grab onto the table and hold on for dear life. That has long reaching effects over time. Balance, neurologic and neuroplasticity, and these changes is not something that can't be changed right now. And through activator poles, it can be, but you need to challenge the system. If the system is not challenged, balance cannot get better when it comes to standing and walking and fall prevention. If you do sitting balance exercises, you can help your posture and help from falling off the chair, of course. But balance exercise requires standing. Challenging the system requires standing. Activator poles allow you to challenge the system without holding on in a way that creates a problem. Again, if you hold on with the palms of your hand, your brain is very happy. And I would almost tell people, if you're with your therapist or you're with someone you want to try, hold on to your kitchen sink with your hands, and then when with someone around you, take your hands off. That can be hard, but or make a fist or put the back of your hands on the sink. That's hard as well. The reason is you have so basically all of your sensory feedback comes in your palms of your hand. With the activator poles, the feedback happens mostly here, which gives less feedback to the brain for the purposes of balance. The benefit of the activator poles is you have core activation in a very unique way. So when you're pushing down through this side, you have core activation, which hopefully will allow your core to get stronger in standing, which will again help with your standing balance. All of this is intended for functional improvement. You got to think about what can't you do that you want to be able to do in standing. Usually, it's just a matter of getting to transfer better on and off a toilet, on and off a bed, walking a small distance. Everything I've spoke about today, ladies and gentlemen, is about that. Okay. And if you want to do more activities in your backyard or more activities with your family, then that's where some of the advanced activities that I listed can be incorporated. And of course, you could start a full-fledged walking program with the activator poles. The only thing better than standing, for exercise is walking. Okay. Walking is the best exercise. And obviously, the activator poles are meant for that. Walking is very important. But for fall prevention, if you can't walk because you may fall, that's the stuff I'm talking about today. If you're too fearful of walking because your balance is off, standing is usually tolerable. You usually can accept standing in the right circumstance. So for people who have fear of falling, this is a good introductory way to start and advance, as a nice low dose, and then you can increase the dose of exercise over time. And as I've indicated before, which is imperative in my opinion, is getting good motor responses, not just doing exercise with eyes closed or with your head looking down or focusing on something. That's not going to help the balance system in a long-term way. It helps in for short spurts. It may help if you focus on something. With your eyes closed, people will say, well, what if I walk in the dark? My answer is you should not have a dark room. You should have some sort of light somewhere. Oh, I can't go to sleep. We can go back and forth with it. At the end of the day, fall prevention requires vision. So walking in the dark is never a good option. So lights are important. But if you lose your balance, regardless of all of that, you need to be able to recover it. You need the muscles to work. And everything I spoke about today is really focusing on that to allow for weight shifting, to allow for rotations, so that you're not stuck like a robot where you're just walking small steps and feel very stiff in walking. Your balance system needs some ability to shift weight, so that your arms don't just flail out, so your legs can do the work. So that's the main reason why, hopefully, you've learned a little bit more today about why you, as a clinician, why you can why you can use it with your patients, and if you're a patient, why you can, of course, ask your therapist to incorporate it, or you could consider incorporating it into a program as well. So, look here. So that's basically all I have. Let's see. So I do appreciate the time. I've left a little extra time today to make sure we can get as many questions and discussions in as you would like out there. I believe, Joy, they could open up their mics if they have a question, or do you want them to raise hands? I think there's one person who raised their hand before.
She did, and she, thank you very much, Dr. Kanter. That was excellent. All things that I'm have soapboxes about and talk a lot about as well. So I love hearing it come from somebody else as well as a physical therapist. The lady that had a question at the first just had a technical question and she got that
Okay,
figured out. So that is perfect. Other people, if you just want to put it in the questions or in the chat box, I do have a question. Can you explain what the curly steps exercise is?
sure.
Giselle Davis asked about.
Sure. So the curly exercises, it's actually named after Curly from the Three Stooges. Um, and it's the concept that when we take a step, we have to take a step to catch our balance. And a curly step is taking three small steps forward, three small steps sideways, three small steps sideways, three small steps backwards. So when the curly shuffle is done, if you go to the YouTube and see the curly shuffle, he moves his feet very quickly. So it's a way to teach our body when we lose our balance to take a quick step rather than freeze up. That's an advanced exercise that needs to be done with someone. But the whole concept is, if you take three small steps sideways, three small steps backwards, you're going to feel your body work, because when you step with this leg, you have to stand on this leg. And that type of work, for people with balance problems, sometimes they've lost that ability to weight shift.
Excellent. Yes. So we have somebody, I believe, who is an end user here, wants a copy of the charts or the exercises. Is that something that you could provide to us and then we could send it out with the recording?
The slides. What's on the slide is the same thing.
Can we provide them, can we provide them the
The
slides
slide?
afterwards?
Yeah, for
Okay,
sure.
perfect. And then Angela asked, does Dr. Kanter teach other webinars on this topic?
Um, uh, for for fall prevention, I've taught in different places in different ways. An activator, it's whenever Joy calls me, I'll be speaking about the activator.
Exactly. So we will definitely be having him back, and maybe next time he can progress it so that we talk about exercises that are a little bit more advanced instead of for this level of clients. That would be excellent. Let me see. Is there an evidence base for polls, case studies, etc., for these products covered by Medicare or just a purchased product? Thank you. Do you
I mean,
want to talk on that?
yeah, I mean, from an exercise standpoint, a lot of the exercises that I'm recommending are similar to exercises that are published. The issue with exercises that are studied and purported as being effective or not effective, it's a very controlled situation. In rehabilitation studies, they're controlled for certain situations, a certain amount of time, and in my opinion, it doesn't tell us a lot more of what we know. Now, with activated poles, Joy, I don't think there's a lot of studies on balance at this point. Correct? Are there any studies on balance in activated poles?
There are some specifically talking about polls and how there's evidence to show that they reduce fall risk by outcome measures such as the tug. They look at the 6 meter walk test. They look at single leg stork test. So there has been some research that's showing um, there was one that was specific to the activator poles, and they did a modified version of the Otago fall exercises and received at the end, they showed that there was improvements in outcome fall risk outcome measures. So yes, and if you guys are interested in finding some of these research articles, you can go to urbanpolling.com and there's a tab for research. But in a broader perspective, the polls definitely have over 300 articles, not specific for balance, but in general, for Nordic walking and pole walking that do have results that show that they improve people's balance and reduce fall risk and help with upright posture and those kind of things.
And I definitely want to reiterate the whole concept of the home exercise program, um, using them daily. Again, it could be for 3 minutes, 30 seconds each exercise, 3 minutes, not a long time. The analogy I use in clinic often is, people wonder dentally, how do you stop cavities? Well, you brush your teeth. You don't have to go to a dentist to stop cavities. For 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 physical therapy, you don't need to go to a physical therapist to improve your balance. You can also do stuff at home, just like brushing your teeth. So, I use that analogy for exercises. I use it especially for stretching. So it's important to appreciate that. And studies usually don't ever talk about home exercise compliance and where that fits in. So the most important thing that I hope everyone takes out of it is a good home program and hopefully including the activators.
And one additional piece to that question was about Medicare. And we are working to try to get Medicare approval right now. The company's out of Canada. And so it's taking a little bit longer. But one of the things that we do talk about is that there is you can write a justification letter. And so some people will submit that and get it approved through their insurance companies. We've seen that happen before. If you can justify why the poles are better than the other assistive devices that are out there, which are some of the things that Dr. Kanter explained today. So I missed the first half hour of the webinar. Just want to reiterate to everybody that you will get the recording of this presentation today in the follow-up, and that should be coming probably within the next few days. You'll get it as in an email format. Do you have exercises to strengthen ankles?
Well, the up on toes, up on heels, the side benefit, the secondary benefit of that exercise is ankle strengthening. You're going to use almost all of your ankle muscles for that, up on your toes, up on your heels. And that's again to me a go-to. And the truth is that the marching in place will help with ankle strengthening on the leg that is on the floor during that exercise. And even the forward and backward weight shifts have a benefit towards ankle strengthening itself. Again, when we think of strengthening, we've got to get away from the concept of weights and therabands and just resistance, versus weight shifting, which is really what I propose overall. If you're with a therapist, the therapist may have you do these exercises faster, and that will change the amount of work the ankles need to do, versus, again, the concept of heavy weights or heavy bands.
Yeah, and yes. And so Angela writes, just an FYI to everybody, these poles have been a life changer for some of my clients. Love using them. I'm looking forward to trying these new exercises with them. Um, do you recommend using one pole or two when walking long distances?
That is all based, the general answer for everyone that I start with, again, having not evaluated you, of course, but even my patients, when they ask, do I need to use two, because I always do my exercises with two poles, is two will just create symmetry. It's not like two canes. Two, when you walk with two canes, it's almost like you're struggling and you need to work really hard. What people use the activated poles who don't have major impairments use them for more efficient walking patterns. So my default answer to that is use two poles, and even people who have weak upper extremities can use. I have a patient who can't lift their arm as much on one arm. We could create two separate heights in a way that's functional because she doesn't need the grip. So the default answer is two, but the truth is you need to be able to that you can use them safely, not trip over them, just like any assistive device. Um, but if you're able to use two, I would recommend two for the symmetry of your walking pattern.
That's my default answer as well. So, will this work if you've got a spinal cord injury with balance problems?
Um, yeah, again, it depends on what level your spinal cord injury is, of course. If you can stand by holding on to something, um, then you may be able to use the poles. If you can stand without holding on to anything, but your balance is off, you definitely can use the poles. So if you have a lower level spinal cord injury, it should not be an issue. Now, again, you may be off balance just like you would with any standing exercises. So these are intended to enhance a standing exercise. If you have a spinal cord injury that's a little higher and you can't stand easily, like I said, I've used the activated poles in sitting, which will incorporate other elements uh, that weren't discussed here, but it's definitely something that can be done. I hope that answered for that person.
In my 12th year of Parkinson's and now using a walker to prevent falls, I've had 71 falls so far, only had one radial fracture, suffering intensely from nerve pain in the legs. Is there any hope for me?
Yes, the answer is there's always hope, but the question is, you know, what do you want hope with? You have pain, you have falls, you have the Parkinson's, and that becomes the challenge, right? But the challenge itself is take one thing at a time. So hopefully your physicians are dealing with your pain and you're managing your Parkinson's. Um, when it comes to falls with Parkinson's, there are many reasons for that. The activator poles may not be appropriate depending on your walking pattern, and depending on how you feel. But the activated poles can absolutely be used for standing exercises like I presented today with someone with Parkinson's, because we're not dealing with any type of a Parkinsonian gait or anything like that. So if you can improve your balance, you should have fewer falls. It's pretty remarkable that you're keeping track at 71. I do wish my patients would do that more, but sometimes that becomes overwhelming itself. But if your physical therapist can assess where your falls are happening, then they can treat those. But for standing exercises, honestly, I don't know a reason why you couldn't do standing exercises with Parkinson's as well.
Absolutely. And that's what I always try to say too, is that it's not all or nothing, right? You don't have to use the poles for walking and for exercises. But when you're in therapy, sometimes just using the poles in a standing position is going to be more challenging than some of the other things. So absolutely. And then
Yeah,
I
and some,
think,
I'm sorry, and some therapists, physical therapists, occupational therapists don't want to use it in clinic because they want to do something else. So you may bring the poles in to review your home program, and that's it. And you may never walk outside with them because you just don't want to, and that's fine as well. But when it comes to fall prevention, you have to find ways, smart ways. Whoops, sorry. You have to find smart ways to be able to decrease your risk of falls.
so we have just, somebody's asking about using poles with neuropathy.
Yeah, neuropathies, again, a generic term for problem with the nerves. Um, it should not be an issue as with standing exercises versus any other standing exercises. And if you're walking with neuropathy with a cane, I don't believe there's any reason why you wouldn't walk with the activator poles and learn, after you learn how to use them. Neuropathy, like pain and pain syndromes, those get managed while you address movement disorders. It may hinder movement. It's obviously not comfortable or annoying and relevant for sure, but you don't treat the neuropathy first and then the movement. You try to manage the neuropathy while moving. But there's nothing that I'm aware of that would indicate that you shouldn't use the poles for standing balance exercises with neuropathy. Again, if you're able to stand safely, um, holding on uh, uh, to anything, you should be able to use activator poles. And if you're able to stand up without holding on to anything, then you absolutely could expand your activator pole balance program.
And a lot of people have told us for walking, actually, if they have neuropathy, it gives them the confidence that their feet are going to clear because they have some additional support to be able to pick up their feet a little bit higher. So we've heard that as well. So it is time. We need to get off, like I said, just a little bit early because we do have another course after this. But I want to end with this testimonial from George. He said, "Great presentation. Thank you so much. As I said, I am 89 years old and work full time as a telephonic interpreter, sitting by my computer 8 hours a day. These poles are a life-changing tool as I was losing the use of my legs. Poles are restoring all of the functions that you just described." So thank you very much, Dr. Kanter. This was an
Thank you.
amazing presentation. Everybody else, you will get a copy of this recording. If you have questions, Dr. Kanter's email is right here. I think we got almost all of them answered today, if not all of them. So again, thank you so much, and we will be
Thank
in
you
touch
very
soon.
much. Have a great day, guys.